Hi, this is Dr. Gartner, board certified plastic surgeon. So we've made a list of all your questions about tummy tuck from Instagram that you've asked, and we're going to answer them and get into them in just a minute. So question number one is,
after the surgery, can you go home?
After the surgery, can you go home? Yes. I do the surgery in a same-day surgery center. We have our own facility here. I've always sent the patient home even before I had my center. There are a few doctors who are more comfortable staying overnight, but in 16 years of practice, I've always sent the patient home after the recovery period, after we see it's safe, when you're no longer under the influence of anesthesia, and it's safe by our guidelines that we follow to send you home. You do go home the same day.
Second question, why do you see puckering in the belly?
Okay, so it's common after a tummy tuck to see puckering in the belly. So what happens is I put progressive sutures in, progressive tension sutures. So what this does is when we lift up the skin and bring it back down, I put these stitches in underneath that close that space. This allows for a quicker healing time and the incision to heal better. Now I use absorbable stitches for those things, so those puckering always go away in a few weeks.
Is the recovery of a tummy tuck similar to a C-section recovery?
So this is a very common question. Is a tummy tuck similar to a C-section? Well, sometimes I have some patients who say the C-section was worse, and sometimes I have some people say the tummy tuck was worse from patients having both done. So the real truth is they're completely different operations. With a C-section, we're going through a small surface area. They go through the abdominal wall. Tummy tuck, we stay on top of the abdominal wall. With a C-section, obviously they take out the uterus, deliver the baby, stitch the uterus closed, put the uterus back in, stitch the abdominal wall closed, and they don't really go fiddle with the belly button and tighten the skin and all this. Also with a C-section, you're tight with the baby in there. After the baby is in there and delivered, you're loose. So with a tummy tuck, it's a broader area, involves the whole abdomen. We lift up the skin, we bring it down, we don't enter the abdominal cavity, and we make it tight. So we also tighten the muscles as well. So after a C-section, your muscles aren't tightened. So it's kind of opposite in that you're loose before the tummy tuck, and then after the tummy tuck, you're tight. So it's a completely different operation. It's kind of like comparing apples to oranges kind of thing. Some people say it's worse, some people say it's better. It's really not comparable because although it's the same area, they're two completely different operations.
How much time do I have to take off of work?
So for a tummy tuck, average person would need 2 weeks to go back to a desk type job. To go light exercise would be more like 6 weeks. To do crunches without fear of popping any stitches would be more like 3 months on average.
Would I lose my tummy tuck results if I have kids after?
Well, that is completely unpredictable. Yes and no. I've had that happen to a few patients of mine. Accidents do happen afterwards. So some people bounced back and didn't need anything. Some people did need a revision. Sometimes there's a little bit more scarring involved because the skin's not stretched out as much. It's stretched out enough so the patient's unhappy with the way they look, but maybe not enough to bring it all the way down. So the answer to that is maybe, maybe not.
Awake tummy tuck, is that something you offer?
At this moment, I am, as of today, where are we? We're October 8th, 2018. I am not offering awake tummy tuck. It is something I am researching and looking into. I do offer awake breast augmentation, awake liposuction, awake facelift, awake labiaplasty, and then a lot of lumps, bumps, and earlobe repairs and all sorts of stuff like that I can do awake, but I'm not offering it at this time.
Can you still obtain abs naturally after a tummy tuck?
Yes. So basically after you're healed, you can still do crunches to build up your abs to try and get that tighter look.
And the price range?
Prices are listed on my website. Go to www.gartnerplasticsurgery, and on the top icon on the top, you'll see prices. Okay, and you go down there, you can see, those are average prices. If someone's a complicated case, they may take a little bit longer. There might be a need to cover a little bit more anesthesia costs and things like that. But those are the most common prices we have in my practice. All right. So great, thanks for your questions, really appreciate it. If you like these and want more videos, please hit the subscribe button. Ask us any comments of any Q&A you might want to see in the future, or any other subjects possibly on plastic surgery. Looking forward to it.